Hi, fearless warriors. Welcome to Surviving Shock. I am Stacy Johnson, and I'm so glad you're here. I was in a training last night. I am a clinical therapist and a woman empowerment coach. And so, part of my therapy licensure, I have to attend so many hours of training each year. And so, last night's training was on somatic techniques. And I was quickly reminded while I was in this training that I already use somatic techniques inside my therapy practice, along inside my coaching program. I mean, this is when we're talking about regulating our nervous system, that's what we're using. We're using somatic techniques. Because did you know that when you have faced some kind of trauma, and surviving shock is trauma. It may be that you had a loss, or maybe you're going through a divorce. Maybe there's been some dramatic change in your work environment. Something has, so that can be a trauma. People talk about traumas, being that you were abused in some way, or you experienced some kind of, maybe you were a veteran and you were in war. But trauma is also something that we go through, a shocking event, something that has changed our life, and we weren't expecting it. That can cause trauma. And so we hold our trauma inside our bodies. And that is when I'm talking about regulating our nervous system, that's what I'm talking about, is how do we move this trauma from our bodies so that we can also, function in life. I had a client that was working with me. She had been with therapist for many years before and had stopped. And then she was working full time, and she had to take an earlier retirement because her husband was ill. And so she was taking care of her husband for a little while. And then he passed away. So she started back into therapy, dealing with the loss of her husband. But through working through that grief, she realized how much she was overthinking. And she also realized, when she started working with me, that, she's attended therapy for a little while and it wasn't changing anything. So she reached out to me as a coach, and we worked on the overthinking piece, but I also gave her somatic techniques that helped regulate her nervous system. We worked on them together. It's like the hand and the glove. They have to go together. And so when we started working on those things together, she noticed a huge change in, one, her overthinking had stopped. Two, she was sleeping through the night. She was not having headaches as often as she was. And she noticed a decrease in her blood pressure, that her doctor was talking about decreasing her medications that she was on for her blood pressure. So three major things changed when we started to combine both techniques. And so some of the techniques that, we use in so they call them somatic techniques in therapy world, but they are techniques that can help regulate our nervous system. And so, taking a deep breath with intention. So, breathing in for 4. So let's do this together. Breathe in for 4. Hold it for 4. Release it for 4. And then hold it again for 4. But the other unique thing about breath is that it's ours. So we can do that any time of the day, anywhere. and no one really knows what we're doing. And if we really want to release some of that worry that we have when this overthinking brain takes place, we bring in, and we bring it in for 4, hold it for 4, we release it for 6, and at the end, we really bring it out. That's really, indicating to your brain that you're releasing that tension. Because trauma, like I said, can come into our body and hold it there. And so when we hold it in our body, it can cause other physical symptoms that we a lot of times go to the doctor for. I've had other clients come to me that said, I've been going to the doctor for 6 months because they can't get my blood pressure to come down. Or I've been having seizures and the doctor has done every test they possibly can and has told me that it's my anxiety. So our body can do amazing things, and our brain signals to our body a lot of these, way we interpret and perceive the information that from the experiences that we've had will cause these body. And so, like I said, people will go to the doctors for months trying to treat physical symptoms, and we push off, especially, if we've gone through an event like a loss of a husband, like I did. We push through. I pushed through for many weeks. I did have a headache for a little while. And I kept pushing it off. It's like, it'll go away soon. I just have to get through this, or let me get back to work and get back to a routine. Everything will be fine. And then it wasn't until I took a deep dive down into what I really needed to do and said, wait, pause for a minute. You've experienced a trauma and everything is dysregulated. And so I started changing the thoughts. I started changing what I said to myself, and I started doing things for my body. And working all those things together, I started to, find that I was resilient and I was managing my stress. And now I don't even remember the last time I took Tylenol or ibuprofen for a headache. My blood pressure is within the normal range. I don't have any back pain like I used to. So, combining what I learned last night in my training, the somatic techniques, along with some of the cognitive techniques that I teach, these are all things that can help us, regulate our nervous system and stop the overthinking process so that we don't stay in this loop. And next Thursday, on February 27th, I'm actually doing a free masterclass, and the link will be in the comments. So make sure you grab that link if you're interested in learning more about this cycle. And I'm going to provide some techniques for stopping the overthinking, along with regulating our nervous system. And on top of it, I'm giving anybody that attends the masterclass a access to my free illumination toolkit. So you're going to get 2 for 1 by joining. So make sure you hit that link below for that masterclass so you can sign up, because spots are limited. It is going to be virtual. And anybody that does sign up, if they can't attend live at 2 p.m. Eastern time, the replay will be sent to them via their email. So again, thank you, and I will talk to you soon.